Okay, we now move on to abortions in sheep. Okay, we need to secure an early, accurate diagnosis for effective treatment and institution of preventive measures. In most cases, abortions can be stopped if these measures are taken immediately. Okay. When abortion occurs, we save the aborted fetus and the placental membranes in a chilled plastic foam cooler. We do not freeze it, nor do we allow it to decompose, as that would make the diagnosis very difficult. Okay. This sample is given to a diagnostic laboratory, and what we do as far as the herd, we immediately isolate all the ewes that have been exhibiting abortion. Okay. Also, as a measure, we also clean and disinfect the contaminated areas. Okay. Here are some other causes of abortion in sheep. We've got vibriosis, enzootic abortion of ewes. It's also known as chlamydial abortion, leptospirosis, toxoplasmosis, listeriosis. Okay. Let's talk about chlamydial abortion. Okay. This disease causes abortion during the last month of pregnancy. Also causes stillbirths in weak lambs that soon afterwards die. It is transmitted from aborting sheep to susceptible individuals. The diagnosis is via identification of the organism in the aborted fetus, tissue, or uterine discharge. We can prevent it by maintaining flock isolation and rigid sanitation during gestation. Okay. The abortion epidemics due to this disease can usually be stopped or reduced by treatment of the entire flock with tetracycline, according to the same dosage as that for vibriosis. You see, vibriosis and chlamydial abortion, they can occur simultaneously in a flock. There's also a combination of vaccine that includes both chlamydial abortion and for vibriosis. Okay, we now move on to toxoplasmosis. It's caused by Toxoplasma gondii. It causes abortions in the last month of pregnancy, also stillbirths and weak, uncoordinated lambs. Okay, the organism is a coccidium of cats spread to sheep when feed, water, and the environment become contaminated with cat's feces. Okay. Lab exam of aborted lambs and placental membranes would confirm the diagnosis. For this disease, there are no vaccines, treatment, or specific control methods. What we do is we control farm cats and keep them away from pregnant sheep. Any ewe that aborts should be immediately isolated. The area in which she aborted should be carefully cleaned and disinfected. Okay. For listeriosis, can cause abortion as well as problems with the brain and central nervous system. Although the latter two forms of the disease are usually not found in a sheep flock all at the same time. Okay. The organism is Listeria monocytogenes. It can grow and survive in moldy or poorly fermented corn silage. Sheep producers should be especially careful to make well-cured silage with a low pH or a high acid content. Moldy or spoiled corn silage should never be fed to sheep. When abortions do occur, flock treatment with high levels of one of the tetracyclines may help reduce the incidence of problems. Okay. Other causes of abortion, there are other causes such as salmonellosis as well as brucellosis, which do not commonly occur in sheep flocks. Okay, now here's a, picture of the testes of sheep infected with Brucella ovis. Okay, we now move on to lambing problems. Okay, when should we help when there's a lambing problem? Okay, the cervical dilation period takes about 2 to 6 hours, during which the ewe would be somewhat uneasy. This is described as the first stage of labor. When the head or feet of the lamb enter the vagina, it stimulates the abdominal straining to expel the lamb. This is now the second stage of labor. Okay. The actual delivery should only require half hour to 2 hours of this straining. If no fetal parts enter the vagina because of problems in positioning, the ewe may not show active straining, but she will definitely show uneasiness and signs of discomfort. Okay. You should examine the ewe if she has been in the first stage of labor for 2 to 3 hours and doesn't start actively straining. Okay. We should also examine the ewe if she has been in the second stage labor for about half hour to 1 hour with little progress. Okay. We should also examine the ewe when the water sac or membranes have been evident for half hour to an hour with little progress. Okay. For the examination procedure, we need to confine and restrain the ewe. We should also be clean. What we do is we wash off the animal's rectal vaginal area as well as our own hand and arm. Okay. For this purpose, we use a mild soap and then we use shortening oil as a lubricant. Okay. We keep our fingers close together so as not to puncture the reproductive tract. Okay. Our hand enters the vagina and identifies the cervix, or at least the extent of its dilation. Then we determine the presentation and posture of the lamb as well as its relative size. The presentation refers to whether the lamb is coming forwards or backwards. Okay. Both of these are normal presentations, and you should not turn the lamb around just because it is coming backwards. If cervical dilation is relatively complete, the water bag may be broken, if necessary, in order for us to examine the lamb. All right, here's a picture of a normal anterior presentation, which is shown on your left, and a normal posterior presentation, which is shown on the right. Okay, again, the posterior presentation is considered normal, and there's no need to turn the lamb around. Okay. If the cervix is not well dilated, you're probably rushing the process and should allow some more time. Okay. If we need to identify if what we're holding on is a front or back leg, what we can do is probably compare the one that we're touching to the leg joint of the ewe that we're trying to assist. Okay. The posture which we need to identify refers to the placement of the feet and the head. In the frontward presentation, the normal posture is for both front feet and the head to be coming together, as in like the lamb was doing a diving position. Okay. On the other hand, in the backward presentation, the normal posture is for both hind feet to be coming together. Okay. Deviations from any of the above should be corrected before attempting to actually pull the lamb. Okay. If a leg or the head is turned backwards, we should repel the lamb back into the uterus between contractions and manipulate the body parts into a proper position. Be careful in pushing the lamb back so you don't risk rupturing or tearing the uterus. Okay. We need to be patient and apply slow, steady pressure. Okay. If the animal is small, like a small lamb, it may be pulled even with one leg back. What we can also do is using our hand, we cover the foot or the mouth during manipulation so as not to puncture the uterus with the hoof of the feet or the teeth of the mouth. Okay. A snare, small rope, or OB chain attached to the deviated body part will allow a much greater pulling force to be applied than what you can exert with only one hand in the uterus. Okay. Also, it would help if we can get the ewe to stand up or at least elevate her rear quarters off the ground, which will allow for more room for repositioning and result in less vigorous straining. A true breech position is when the lamb is coming backward and both the hind legs are retained inside the uterus rather than extending back into the vagina. This is one of the most difficult to correct. The lamb must be repelled forward, and then the legs straighten out behind, one at a time, if we intend to pull out the lamb. Okay, here's a picture of abnormal presentation. Okay, the lamb is presented with just only one foreleg inside the vagina. That needs to be corrected because it has to be in a diving position. Okay. We now move to the middle picture where we can see that two forelegs are inside the vaginal canal. However, the head is turned backwards. Also, this one needs to be corrected. And then the last picture is a true breech, and as we mentioned before, it's one of the most difficult positions to be in. Okay. The cause of most dystocia or difficult birthing is a lamb that is either too large in relation to the dam's pelvic opening, or a dam that's too small. Okay. An excessive stress in pulling and delayed delivery may result in a dead lamb that has to be cut up for removal or taken out using cesarean section. Okay. Not all lambs will show strong evidence of life, especially after they have become fatigued. What you can do is you can feel for movement, heartbeat, and reflexes such as a leg jerk, eyelid blink, sucking, or a rectal pinch. Traction is important, and for this we use obstetrical chains, which are the most sanitary and the most easily applied device for this purpose. One should be placed on each of the two legs, and another one, or probably we can substitute the snare on the head. This technique allows for traction on the individual body parts. Okay. The head chain should be placed in the mouth and behind the ears to provide better control, and this is also to avoid crushing the windpipe. It is usually best to have the head chained up in case it is needed for guiding or traction, rather than pulling it without any of these, because this could get into problems down the road because the lamb isn't ready to be delivered yet. Okay. We should also take time to stretch the lips of the vulva back over the head of the lamb when the head is partially out. For traction, this will reduce the tearing of the tissues, as well as reduce the amount of traction applied. So if we rush at this point in time, we would cause tears in the ewe, and this would translate to a longer recovery time for these animals. Okay, when we're able to successfully deliver the lamb, we have to make sure to check if there's still another lamb inside. Okay, usually there may be more than one in there. Okay, we also need to have some towels available to dry off the lamb. Also, we need to have iodine to apply to the navel, and we need to ensure that the lamb gets colostrum within 30 to 60 minutes. Okay. If needed, we need to warm up the animal, and also we need to assist the ewe in standing and keep her off slippery areas if she is wobbly. Okay. We should also clean up the equipment and put it back in its storage place. Okay, we now discuss floppy kid syndrome. Newborn kids seem to do well for a few days. And then afterwards, they start to show depression and weakness of limbs, which progress to flaccid paralysis. Uh, this condition would oftentimes appear as a drunken appearance. There are no signs of diarrhea or elevated temperature, and sometimes you would see a possible distension of the abdomen. Okay. What we do here is we remove the kid from the source of milk immediately for 24 to 36 hours. We then dissolve a teaspoon of sodium bicarbonate in a glass of water. With a syringe, we administer between 20 and 50 cc of the solution orally. We do it slowly so that the kid has time to swallow. This treatment is repeated at 1, 3, 6, and 12 hours from the initial treatment. We can also feed electrolytes as alternative until the animal has been returned to milk. We also need to administer a wide spectrum antibiotic to prevent secondary bacterial infections. Okay. Here's another possible solution. 1/2 teaspoon of baking soda mixed with electrolytes and half teaspoon of Pepto-Bismol. Okay. The treatment is repeated in 6 to 12 hours. When this treatment is utilized, we are not required to pull the lamb away from the mother's milk. Okay. Third solution is if the kid can still walk but is wobbly, then we give 2 cc of long-acting penicillin orally and 500 mg of thiamine. The thiamine is mixed with the penicillin and is imperative to recovery. This treatment should be effective within 6 hours. Okay. If the kid is comatose, we should give 5 cc of 50% dextrose orally, and the animal should be kept warm. Okay. We give the penicillin and thiamine for 3 days, once a day. All right, that's it for reproductive diseases as well as some lambing problems.